So our first question says, from a psychological perspective, how do you explain why some of the public is resistant to COVID-19 protocols like mask wearing, vaccinating, or avoiding large gatherings?
I don't mind starting this one. I think one of the things to remember is that there's probably a couple dozen reasons why people don't adhere to the mask wearing or avoiding social situations or any of the safety recommendations. I think sometimes we would prefer to just have like one reason, and that probably not a good reason why people are not doing it. But it's important to remember that those are decisions that people make, and they're based on information that they have access to or that they're listening to. And I think for a lot of people, the impression has been that there have been mixed messages about safety, even though I think from a science perspective, it's been pretty consistent the whole time. But I think for some people, they feel like, why does it help? We've been doing this for so long and we still have all of these outbreaks, so clearly it's not working. And so I think one of the important pieces to remember is that for a lot of people, it's not necessarily malicious, or it's not necessarily that they think that they're going to cause any harm. It's just that they may have different sources of information about what they should be doing. That's part of it, is the decision. There are also, of course, personality traits. There are different levels of aversions to wearing masks. There are different levels of aversion to being told what to do or how to behave. So that's part of it also. I can tell you that people have been digging into the psychological research of why people don't wear masks. And a recent study, I think for all of us, it's important to know, said that yelling at people doesn't work. So generally the people that are not wearing masks because they are choosing not to wear masks, yelling at them or telling them what they should be doing is probably not very helpful. Most of the research suggests that being very pro-social, so continuing to wear your mask, continuing to model behaviors that show that you're taking this seriously is sort of the best that you can do. And then in the meantime, I would just, as I usually say on almost any of these questions, try and have patience with people. I'm not okaying people who sort of are not playing by the rules, but I also think that part of that comes from a place of uncertainty and anxiety. And so as much as we can kind of show people some sympathy or empathy and patience, and again, just modeling those pro-social and sort of risk mitigating behaviors are the best we can do as individuals.
Awesome. Thank you, Dr. Davalos. All right, next question. I've heard some stories going around that certain blood types are more likely to get infected, and people getting infected from a nasal pharyngeal swab, pushing the virus farther into their nose. Are there any truth to these?
Well, I'll take a stab at that to start with. I have not heard anything that said that people could get infected from pushing nasopharyngeal swab further into their nose and introducing the virus further up their nose. Maybe Mark or Nicole have heard something along that line, but I certainly have not. And there is a little bit of information that certain blood types may be more likely or may be more resistant to infection by this virus, but that keeps changing. So maybe there's some updated information that Mark or Nicole will have on that too. So my answers are pretty equivocal when I look at this.
Yeah, thanks, Bob. I'm not such an expert on the nasal swab pushing virus further up the nose, because I am not a medical doctor. Although I would, at first blush, I would say that the virus is already way up in the nose and it's draining down into your nasal cavity where you're swabbing. So the virus is already there. So it's unlikely that it's pushing it up further into an area that's not already infected by the virus. Bob is right in terms of different blood groups conferring some sort of resistance. I think it was back in October, there was conversation about this, or maybe even earlier, centered around a study, a retrospective study from Denmark, looking at individuals who had contracted the virus and looking at their blood types. And they did notice that the O group blood types were less represented in the infected populations versus the general population. And that's where that idea sort of started to spawn. And I'm happy to conjecture about why that is. I have a hypothesis for why that might be true. However, subsequently, since then, some questions have been raised about that study, and when they've been surveying after that, they really haven't seen a strong correlation, at least not as strong as that retrospective study in Denmark. And the reason might be that the Danish population is a pretty homogeneous population, and these differences may not sustain themselves when you look at a wider variety of individuals. So right now that correlation is sort of shrinking away. And so currently there's not a lot of evidence to show that association that was proposed back in the fall. And Dr. Earhart may have additional information.
Yeah, I would agree with everything that Mark and Bob shared. Certainly no evidence whatsoever that by performing a swab of your nose, you can push the virus higher up in there and create a worse infection or create infection where there wasn't one. There's no evidence of that. The part about the blood types is a really interesting correlation, but I think when we see these things, it's always important to remember that correlation isn't equal to causation. In other words, you can find correlation with a lot of things, but it doesn't necessarily always translate into something that's clinically relevant. So, could be that an example of that is there was a study that showed that, about, a very high percentage of people who got into car accidents had Chinese food within the last week. And, clearly Chinese food doesn't cause car accidents, and car accidents don't necessarily associate with Chinese food, but this is an example of how sometimes associations can be made when there really is not a clinically relevant effect. I would be interested to hear what your theory is, Mark, about the blood type thing, because I'm interested in that hypothesis. Do you want to share that?
Sure. Yeah. Without getting into too many weeds, so the study in Denmark showed that type O blood was underrepresented, right? And so people had more severe disease if they had type A or type AB. And my hypothesis that blood group typing is based on antigen or proteins that are expressed on the surface of your red blood cells. Type O doesn't have these blood proteins that define the different blood types. So they're considered, if you have type O blood, you're considered the universal donor, because you won't have any reactions against your red blood cells because you don't have those additional proteins that your other people's immune systems might recognize as foreign. And so I'm thinking that some COVID antibodies might cross-react with some of those blood proteins, and so might recognize that A group protein or that B group protein, or the combination of. And if you don't have those, if you have type O, you're less likely to have a cross-reactive antibody and make your COVID disease more severe. So that's my hypothesis.
Thanks for sharing.
All right. How has COVID-19 affected food security, and are we seeing the same effects locally, regionally, and nationally?
Thanks. That, is a really good question to ask, because it may be one of our biggest long-term challenges. Because actually, a year ago, we were in a really good place in terms of food security, better than we had been for decades. And that has changed now. So the estimates are that about 16% more of the total US population experienced food insecurity during these past 10 months. And we refer to food security as having adequate access to healthy food. And these differences aren't equal across the board, though. A study out of Northwestern University indicated that when it comes to seniors, that the increase in food security across the board was about 60%. 60% more seniors experienced food insecurity during 2020 than years previous to that. So it's going to be a challenge to deal with, and something that will probably be a long time to recover from. And as far as how does Colorado compare, well, we fared better than many of the other states. Our rate is currently between 11 and 17% of the state population. And of course, that's going to vary by county and community, by rural and urban environments. But there are certain counties that have been noted for their increases in insecurity, and Eagle County is one of those, which is really increased in childhood insecurity. They don't have separate information for seniors, but it's interesting to note because seniors who live with grandchildren are more likely to be food insecure than seniors that don't. So we're in a tough spot right now, but there is good news. There are many of the food pantries and food banks across the state have become very creative. For example, in Larimer County, now they have developed pop-up drive-through food pantries that are occur different times during a month at high school parking lots. And they have also done things to ensure physical distancing and changing hours, to make it easier for everyone to access food safely. And the other, well, the thing I really wanted to mention at the end, the bottom line is that these community food resources are really helping many people, and they're an important step to our recovery. So because food is not just essential for health, it's also comforting and important for our general well-being. So these food resources are really a good cause to support and a concrete way to help with the recovery.
That was awesome information. Thanks so much. Now we're going to get into a couple questions about the vaccine. Will the new COVID-19 shot change my genes?
Yeah, I'll take a stab at that one. Short answer is absolutely not. So these two new vaccines that are now being distributed from Pfizer, BioNTech, and Moderna, both use RNA, which is a completely new vaccine technology that's never been approved for use before. But one of the real advantages of this vaccine is that it's really, really safe. You're not injecting some sort of modified virus that's supposed to not replicate and create an immune response. So this vaccine should really be safe. It shouldn't really make you sick, except transiently when your immune system is reacting to it, and that's a good thing. The RNA that's in this vaccine is just a set of instructions to make that spike protein that we've all heard about that's on the outside of the virus, that the immune system makes the most robust response against. And so it's just a set of instructions. And that set of instructions is specific for that viral protein. And it's just instructions. It's not the DNA, which is sort of the architect of the instructions that is preserved in our cells and that we pass on to our kids. The RNA, so the DNA is sort of the architect. They create the blueprint, which is the RNA, that then creates the proteins that make up who we are. In the vaccine, those instructions, that blueprint is specific for one protein from the virus. It can't make a whole virus. Those instructions can't affect our genes or our instructions. And therefore, it's one of the safest vaccine strategies that we've developed. And so no chance of altering our own genes.
Mark, that was an excellent summary. And I think the other piece that may bring some comfort to those who are a little nervous about the fact that there hadn't been an mRNA vaccine previously approved, is that the mRNA platform for vaccine has been studied for decades now. It's actually been a very big interest in, for example, cancer treatment, and other areas where we're trying to help the immune system recognize something that we want to get rid of. And in the case of cancer, it's metastatic cells, or cells that are trying to circulate and set up house somewhere else in your body. That, while it hasn't been approved yet, has been studied for many, many years. And there's many examples of clinical trials of people receiving vaccine where they've had extremely good safety records. So while it hasn't ever been approved, mRNA vaccine has never been previously approved, it actually is, as Mark mentioned, probably one of the safest vaccine platforms that mankind has ever come up with. So the fact that we've now got this big leap in technology as a result of the billions of dollars that have been poured into the development of the vaccine, not only is going to help us with COVID, but it will probably help us significantly with other diseases, including things like cancer. So it's a very exciting leap forward for science and technology. And as Mark pointed out, is really has been shown to be quite safe. So if there's anyone nervous about it, at least knowing that there's been study in this over decades will probably help with that.
Thank you, guys. Will I need to wear a mask once I am vaccinated? If so, why?
I'll take that one. The answer is yes. And there are a couple good reasons. I understand why on first blush you might think, oh, I've got the vaccine and now I don't need to wear this stupid mask anymore. And I'll also state that I would expect guidance to be updated on these mask rules as we get into the summer. But for the next 4 to 6 months, I can virtually guarantee you that we're all going to be required to wear masks. And that guidance will come from state and county health authorities. That's where the rules are made. So you can go to those websites. Here's Larimer County, or you can go to the state of Colorado to look for those rules. So there's 2 good reasons why you're going to need to keep wearing a mask. The first, we know that the vaccine helps protect you from getting the virus, but we don't yet know if it stops you from spreading the virus. It likely does, but we don't have definitive research on that topic yet, and hopefully we will as we get into this year. The second thing is, remember that a lot of virus spreading happens from infected people who don't know they're infected. They're asymptomatic, they don't have symptoms. And so if it's true that the vaccine protects you from getting the virus but not from spreading, that could be a potentially very dangerous situation. Another reason to wear a mask is that the vaccine is not 100% effective. It's 95% effective. So that means that if you put 20 vaccinated people in close contact with someone who's infected with SARS-CoV-2, one of those people will probably still get infected, still get the virus. Another analogy is if I asked you to drive your car to Denver every day, but twice per month I told you can't wear a seatbelt, how would you feel about that, right? Because you put yourself at greater risk. And so remember, the vaccine is not 100% effective, it's 95% effective. And for that reason, you probably still want to wear a mask to protect yourself as well.
That was a great answer. Thank you. All right. Now, is the new COVID vaccine similar to a flu shot where we may have to get it every year? Or is it like the measles where we only have to get it once?
Yeah, I can try and answer this one first. I think it's still too early to know whether or not this will be a seasonal event, and how effective or how durable sometimes we call the immunity is after vaccination, because these 2 vaccines were, and even the Johnson & Johnson AstraZeneca vaccines that are in phase 3 clinical trials, went through emergency use authorization and were fast-tracked. This is one of the key pieces of data we don't have yet, right? Typically, we would take a much longer time through these clinical trials, and we would assess over a year or maybe even 2 if the immunity remains. And if not, how often and when do we need to boost to maintain that immunity? Do we have to formulate new vaccines just like we do flu vaccines? We know right now, for example, that the SARS-CoV-2 is mutating, right? And we've got these new, more contagious mutated strains that are popping up. Now, fortunately, it seems like the mutations shouldn't affect the efficacy of the vaccine so far, but they could down the road if new mutations arise. So it's really too early to tell. That data will come in the coming months and maybe even longer, year or so. My guess would be that it's likely to need boosting based on what we've heard about the levels of antibodies after vaccination. But again, that's very preliminary, and we won't really have a definitive answer for months or even a year or more.
I think Mark covered that excellently, but I have a couple things I'd like to add to it. Number one is that there's not a vaccine, there are several vaccines. And we know of 2 of the vaccines that are mRNA based that have up to 95% efficacy, but some of the other vaccines don't have that efficacy. So we really don't know how long those different vaccines are going to last. We don't know if we're going to need a booster sometime. And the second point is we're still really early into this. The only information that we would have at the current time that would tell us anything about longevity is a few months of information from people who were vaccinated in the different phases of the vaccine trials before the vaccines became available for the general public. And so until we get further into this, we're really not going to have solid data that allow us to answer that question conclusively. How long will it last? Will I need a booster? This is going to become much more apparent as we go into the next year or so with this particular COVID-19 disease, with the SARS-CoV-2 virus and the different variants. As Mark mentioned, so far, the different vaccines that have been tested against the most common variants, there's not just one, there are different variants. The vaccines have been effective. From another standpoint on this, with the mRNA vaccines, it should be that the manufacturers should be able to add the variant spike proteins to these as we go further, and as we find that maybe some of these variants are not covered as well by the vaccine. So we have that option. Then more questions arise. What do we do with the people who have already been vaccinated? Do we go back and revaccinate them with the new tweaked vaccine? I think the really important thing to take home here is keep watching and keep asking questions and keep asking people, your physicians or other public health people who know the answers to these, what the most common answers are. People have been accused, and people in very high places have been accused of lying to the general public as we went through this last year of this disease. It's not quite a year yet, let's say 11 months in our country. But I don't really look at this as people lying to us. It's the information has changed. And if we get the new information out, that is the most honest way that we can approach this. And we need to keep watching, keep learning, keep moving forward, and keep informing yourself with the new information as it arises from sources that you can really trust.
Thanks, Bob and Mark. Those are really important statements. And I actually will keep this really brief, but wanted to reemphasize the fact that so far, the vaccines that are approved are effective against the new variants. And this also underscore Bob's comment that there are a lot of people doing surveillance, genome surveillance. So they're basically checking and rechecking and watching these mutations very carefully. And the good news is that the platforms that have been developed for vaccines, as Bob mentioned, should be able to be relatively easily changed, tweaked, or retuned to capture new variants if there are variants that are expected to maybe escape vaccine. So meaning that the vaccine wouldn't be effective for. But so far, all the variants, the vaccines that we've identified, and there are people looking at this in real time every day, they still are effective. The vaccines are still effective against that. So that's a really important point. The second last point I want to make is that this is a great venue for you to continue to stay updated. So we will continue to bring you the best and the most recent information. So as much as you have questions, we're willing to answer. We'll keep doing these until there's no more reason to do them.
Awesome, thank you. What are some of the immediate benefits that we might enjoy? Travel, gathering.
Well, I'll take a brief answer on that one, and then John, I think, would be able to have quite a bit more information on this from his perspective, or Nicole. I mean, I don't think we should relax yet as far as traveling and gathering is concerned. We've seen over the last few months, if we go back to about post-Halloween, just a few days, and then look at the spikes that took place because of gatherings and social gatherings where people were not necessarily self-protecting themselves, then I think the lesson is there until we get to a point where we have, through a combination of vaccinations and active infections, where we actually do approach a herd immunity type status. I don't think we should be letting our guard down yet. And that applies to travel. Another thing that was mentioned in the chat box is that the travel doesn't, protection while you're traveling or while you're in groups of people, gatherings, doesn't necessarily just apply to COVID-19. It applies to a lot of other things too. We're going through flu season, and influenza has been a high impact disease as far as the aging population is concerned. So keep that in mind, whether you're aging or not. If you're wearing protection, mask protection, respiratory protection, you could be protecting, helping to protect a loved one from a disease that may not be affecting you very severely. So I don't think it's time yet. I think we need to watch this for a few months and see what happens down the road.
I'll just echo Bob's point. I think, you know, the immediate benefit you're going to receive is peace of mind for yourself and renewed hope for all of us. But I think we're going to be operating under restrictions for several months because it's going to take several months for us to achieve herd immunity. And I think health authorities, rightly so, are shy about relaxing restrictions right now because we did such a poor job controlling the spread of this virus in 2020.
And I will just add one piece, which is that it's very likely that to travel to certain countries, you may need to show proof of immunization, or at least proof, or you may need to be tested when you get to that country. And that's true of countries right now for things, for example, yellow fever. There are some countries where you can't travel to that country without evidence of vaccination against yellow fever. So I think that it's going to be evolving, and as others have said, you know, it's not time to relax yet, but it's time to keep an eye on, you know, what public authorities are saying, and then also just give the population time to get vaccinated, so that we have a higher number of people that have been protected and a lower number of new cases.
All right. We hear the second shot of the vaccine has rather strong side effects. Are these dangerous for people 75 and older? What about people who are on immunosuppressants? What are they seeing from other states that have administered these to that population, those populations?
Thanks for that question. I actually think that Dr. Jackson would be a great person to field this question. Are you available to answer that, Dr. Jackson?
Sorry, I'm trying to multitask today. It's been kind of a crazy morning. So as far as the side effects of the vaccine, I got my second vaccine this week. I was lucky. I mean, I'm on my second dose. I got it on Sunday, and I will say I definitely experienced more side effects with the second dose. But I will say that those side effects resolved in 24 hours. We haven't started vaccinating our residents, so I don't have any kind of practical experience as far as how my residents will experience the second vaccine. You know, what I would say is that, yeah, the symptoms were unpleasant for a day, but it was only one day and it was short-lived. And I think that the COVID virus itself is so much more dangerous for this population. So for me, you know, it's that risk benefit, and, you know, this potential side effects that you experience for a day or two after a vaccine is well worth it compared to what I've seen with the actual virus and the infection that we've seen travel through our facilities. So yeah, I mean, we'll know a lot more as more people are getting vaccinated, but just from that practical experience, I think I would still encourage people to get the vaccine if they qualify for it.
I would agree with that. I had my first vaccination a little over 2 weeks ago, so a little less than 2 weeks from now, I get my second one. I'm in that demographic over 75. I know I only look about 30, but still, got to believe my birth certificate, darn it. So I had almost no pain at all. If I rubbed my arm where I got that first vaccine, I could feel it. Other than that, nothing. And I had to rub it. You know, it wasn't like I could just touch it and feel it. I don't know what to think on the second one. It's like you've said, some people say more. I'm going to wait and find out, but I'm definitely going to get it. So I think it does affect different people differently for sure, like everything else does. And I think there's no good reason that I've seen not to go through with the vaccinations. Get them. I've been watching on different reports as to what's happened with vaccines, and we do see a sporadic case of anaphylactic responses, very, very, very few, like 1 in a million or 2 million. We've seen a few other things along that line that may or may not be related to the vaccine. So again, you know, there's nothing out there that I've seen so far that says don't do it.
Yeah, and I just wanted to add too that those mild symptoms that Rebecca was describing, and that most people, I think, experience after getting their dose of vaccine, is actually a good thing, because that tells you that your immune system is working and it's responding to the vaccine. And you know, that little malaise, a slight fever, some aches, that's your immune system responding to the vaccine. Again, don't worry if you don't feel that way after getting the vaccine. That doesn't mean that it's not working. But for me, I sometimes get a reaction to a flu shot too, very mild, but that's reassuring to me because I know that my immune system is responding to it.
That's great information. What is the vaccine distribution plan for Larimer County? Is it a lottery system, or will you have to sign up?
Well, it is a evolving process, right? So the first tier of people, tier 1A and 1B, are currently being vaccinated now. And even who falls into tier 1B has just changed as well. Not only that, the transfer of the presidency will also probably change policy in terms of how they roll out vaccine once President-elect Biden takes office. So I think it's going to be evolving. Right now, it is being, and Rebecca can probably add detail to this. Right now, you are being contacted by your physician's office. Banner Health, UC Health in Larimer County are the primary people that are doing this. Associates in Family Medicine is just gearing up to do it as well, but they work through UC Health. So you get notified through your physician's office, primary care office, that you are eligible. And then you go into a website, a patient portal, to sign up to get a spot, and they'll tell you where and when to show up. That may change, where they may do more mass vaccination clinics. For example, they may use stadiums and other, that's being discussed at the state level, and certainly other states are preparing to do that. For example, in Florida, one of the Disney World locations is preparing to be a mass vaccination site where people can, kind of come at will to be vaccinated. But so far that has not been rolled out here in Larimer County. Do you have any additional information, Rebecca?
Not a lot. I mean, it is through the major health systems right now, and a lot of that has to do with it being the Pfizer vaccine is what's available right now. So you have to have extremely cold storage to have that vaccine, which mostly is just hospital systems that are capable of that. So it might change once the Moderna becomes more widely available, and more providers have access to it. We might be able to start vaccinating more people. But right now it's kind of a limited supply, and so they are really trying to follow that tier system as closely as they can, to my knowledge.
Yeah, I think that the Moderna vaccine is also being rolled out now, at least for the CSU personnel who are involved in the COVID response that are part of that tier 1B. I think many of them are getting Moderna. So both are seemingly available, and I think more and more is becoming available. So stay tuned. But definitely, if you have questions, go through your primary doctor's office. They're probably going to be the best people to answer specific questions about your own vaccination schedule.
Yeah, I would agree with that. I got the Moderna vaccine. I was contacted through my UC Health connection and through email because my primary physician is in the UC Health system. So if you're in UC Health, I can't speak to any of the others, but if you have your primary physician in UC Health, make sure that you are enrolled or signed up for the My Health connection through that. And they emailed me first and said to get on to My Health connection and make my appointment. And I did, and had the vaccination that afternoon. So that part's working really well. The rest of the different groups and organizations, I really can't speak for. But I think from that experience, yeah, it was a lottery. Yes, I won. And yes, be your own advocate. If you haven't heard from your primary physician, ask them how you can get in line real quick for that.
And Kendra just posted a really helpful link in the chat, so everyone should check that out if they can, to get notifications about vaccine phase changes. All right, and next question is, how long after the vaccine shots does it actually take effect?
Yeah, great question. So typically vaccinations induce the beginning of an immune response, and that's that general malaise that we were just describing. And generally it takes about a week to 10 days to generate those antibodies and T cells that will be specific against the pathogen that you're vaccinated against, in this case, SARS-CoV-2. So a week to 10 days. And then the reason why it's several weeks apart for that second dose is to let your immune system kind of calm down and generate those, what we call memory cells. So the cells that make antibodies, there'll be some cells that stick around for decades. And just waiting to be re-stimulated in the presence of the pathogen that cell recognizes. And then it just that cell starts dividing and making a ton of antibodies. Those T cells do the same thing. If they're exposed to that pathogen again, they'll divide and start making a new immune response. But we want to let that immune system kind of calm down before we give that second boost. And then that generates an even stronger memory response after that. But again, after that second boost, a week or 10 days, and you should have really, really robust memory and responses against that pathogen.
And I just got a question in the chat that I think is a good one. If a person over 70 is scheduled for surgery, should they get the vaccination first to be safer?
Thanks for that question. And I would certainly lean on Dr. Jackson's thoughts as well, but I think it depends a little bit upon what your surgery is for, how urgent the surgery is, et cetera, and then what your specific potential adverse event profile is. So that's a question you probably want to ask your primary care provider, and they would have the best information for you individually. But Dr. Jackson, do you have other thoughts?
No, I mean, I definitely agree with you. I think it depends on the situation. So it is really good to run that through with your physician and see if you qualify, especially if it's an elective procedure where you might need rehab afterwards. It would probably be a beneficial thing to potentially consider before going to a rehab center at this point. So I would talk through it with your primary care doc and see if you qualify, because that might be a good thing to partner with your procedure.
All right. I have a loved one in a nursing home who will get vaccinated long before me. Can I go and visit them once they are vaccinated?
Well, I will also, again, defer to Dr. Jackson, since she's obviously the person that's closest to this this issue. What I do know through my interactions at the state level and CDPH&E, who make the policy surrounding visitation in senior congregate care living, we are expecting policy guidance to change over time, but right now, that determination about whether visitation is allowed is based upon your county and the positivity rate. But also, as far as I know, still no indoor visitation is allowed, at least in the facilities that I am familiar with. But Rebecca may have further info there.
I mean, they have been changing that guidance throughout this whole pandemic, and they did revise it not that long ago, because the guidance was really restrictive and made it very difficult for families to come into a facility, because it was requiring a PCR, a test result that was less than 48 hours, which was really hard to come by for people. So you kind of have to work with your specific facility, because of all the surveillance testing we're doing. If they're seeing positives within staff or anything else, that it might restrict them. So it's good to work with your specific facility that your loved one is at, to kind of do that. They also have, there is something called essential visitation. So some facilities are really good about providing those for residents if they are really struggling and in need of seeing someone from their family. So there's different ways to be able to see your loved one. Outdoor visitations obviously aren't great during the winter time in Colorado. We really miss the warm weather because we did a lot of outdoor visitations during the summertime. So I would reach out to your facility, but there is guidance, and I can see if I can find it and put it in the link from CDPHE as far as what they allow for as far as indoor visitation goes.
Thank you so much, everyone. We are going to move on from the vaccine questions, but I did want to say that we will be hosting Dr. Ellis for our January Healthy Aging Speaker Series to talk a little bit more about the vaccine and changes in public behavior. And I'll post information on that in the chat. So the next question we have is, how does one get an antibody test, and when should a person get one?
I can start to answer that, and certainly would welcome Dr. Zabel, Dr. Jackson, Dr. Ellis, anyone else who has some thoughts here. The antibody test typically is done using blood. So they're checking for the antibodies to the virus in your bloodstream. And it's typically done in a lab. There are a number of different tests that have been developed and even have gotten emergency use authorization, which are using just like a spot of blood and can be done almost instantly. They tend to be less accurate than looking for specific antibody levels. So the two types of tests is, do you have antibodies, yes or no? But the second question really should be, do you have antibodies that will actually protect you against the disease? So are your levels of antibodies high enough to protect you against getting infected? So the reason to get an antibody test, specifically to know if you have antibodies, would be to know if you've ever been infected. The type of antibody test that tells you whether you have enough antibodies to protect you against being infected at a later date is something called a neutralizing antibody test. And that's something that's not routinely done except in a actual diagnostic lab, or even research labs do this. So that would be more related to determining whether or not you have enough antibodies in your system to actually protect you against a new infection. And that's the type of thing that scientists are going to be following after vaccination over many months, to try to determine how long does that neutralizing antibody level remain in your system that would keep you protected. So how do you get one? You can go to for example, UC Health will run antibody tests. There are a number of different diagnostic commercial labs that will do this. There are sort of at-home kits that are being circulated, which I am not familiar with all of them, but they definitely have a lot of variance in their accuracy. So I guess I would be cautious with those. Other thoughts from the panelists?
Yeah, I apologize, Nicole. Wasn't sure if I was supposed to answer that question. I was looking through the list, so I didn't mean to leave you hanging. My apologies. But no, so Dr. Earhart gave you great, accurate information. You know, it would be interesting. So UC Health is offering that test. I don't know if insurance covers it. It's about $100. Those at-home tests, I think King Super sells one for 25 bucks. But again, with the caution that they are less accurate. And so, you know, you have to weigh that when you do use those tests. It would be interesting for folks that have been vaccinated. I'd be interested to see if, you know, then they went and got an antibody test, what kind of titers, if the antibody test works, and what kind of results you get. That would be interesting, especially if you're one of those that don't have a reaction to the vaccine and you're wondering, did my immune system really respond to that? Maybe an antigen test might be interesting. But for, you know, true diagnostics or for health reasons, I think that information is pretty limited. As Nicole said, it does tell you if you've been exposed at any time, but it won't tell you, for example, if you're protected from reinfection. It doesn't tell you if you're currently infected. That's where you need to have a test that detects the virus and not antibodies.
And I was just going to say, I don't know if it would change anything as far as, like, you would never stop masking or trying to protect yourself and others based on the results of those tests. So, you know, I think that's one of the things when I'm looking at, like, when I order a test, is it going to change my management or change my, you know, behavior, that kind of stuff. And if it, you know, it's interesting information, but at this point, there's not a lot of guidance based on it. So it may not change your outcomes per se.
All right, and I think we have time for one more question. What are some things I can do to care for my loved ones who work in the healthcare industry to help with their stress?
I'm happy to start with this. I mean, I think we know that most folks who are dealing with this are probably having a lot of fatigue and burnout issues and just chronic stress. I think some simple things to do are to try and take things off their plate if you can. So if there are things that you can do in terms of just making their daily load a little lighter, like helping with meal preparation or cleaning or childcare, and really sort of express to these folks, a lot of the people who work in healthcare are just sort of natural caregivers, and they take on that role to the point of sometimes just running themselves into the ground. So be as not forceful, but that you really want to help and you want to do some things, and then just figure out what it is that they are juggling in terms of also being a healthcare worker, like I said, if you can help with cleaning the house or taking the kids for a little bit. And then I think it's really important to remind healthcare workers that there are support services for them. This is incredibly stressful, anxiety provoking, and sometimes causes depression or just feeling like it's difficult to manage your relationships when you're also doing high stress work all the time. So letting them know that you're there to listen and to support them, but kind of anything you would do for anybody who's just sort of in a chronically stressful position. And so I think being grateful and thankful and supportive, and then trying to kind of lighten the load, is maybe the best we can do to support our healthcare workers. And I would love to hear from Rebecca if she has ideas about what sort of speaks to her and the people she works with.
It's such a, I mean, it's so hard because I had like the light at, and we have a light at the end of the tunnel. At least we have a vaccine now, right? So that does provide this like sense of relief for healthcare workers, I think. For me, just honestly knowing that people are wearing their mask, like, and protecting themselves when they're out in public, it's like, I mean, it shows to me, it's like a respect thing too. Like, you show that we're going to do our part. We're going to help the system as a whole and take care of the collective we. So for me, like, that's a really, it's hard for me when I see that in the community. People don't want to do the masking and that kind of thing. So for me, that's always a really helpful thing. So